Well, on the website and on the show, we've been monitoring the dengue fever situation around the world pretty closely, whether it be in the Americas or in Asia, which are both being hit very hard this year. And one country we've been keeping an extra close eye on is the Philippines, because they're having quite a dengue fever situation in the first half of 2019. So that really leads me into what happened on Monday. Health Secretary Francisco Duque declared a national dengue alert because of just this large number of dengue cases being seen throughout the country in many, many regions. And what we saw from some official data that between January 1st and June 29th, 2019, there was over 106,000 dengue fever cases, including 456 fatalities, officially reported through the routine surveillance system. Some information we got: the median age is about 12 years old. The most affected group are children 5 to 9 years old. About 1/4 of the cases are in that group. In addition, about 4 out of 10 fatalities were in that same 5 to 9 years group. And we can see on this chart here, if you're listening on the podcast, I apologize, but we can see that in the recent weeks, we've really seen dengue really shooting up. In week 26, over 8,000 cases were reported in the country. And on the map, we can see how these dark colors, northern Luzon, very heavy, the western Visayas, many parts of Mindanao, getting hit really, really hard with dengue fever. And then we have this report from the Philippine news source Inquirer.net, and they actually came out with even more updated numbers. And it says the DOH, the Department of Health, reported 115,986 cases of dengue through July 6th. So that's an increase of about 10,000 in 1 week. And this is about double the cases during the same time frame in 2018 when the Philippines saw 62,000 cases. And there's been epidemics declared in a number of regions, at least 5. So it's a big issue going on in the Philippines. And it's expensive, right? The Philippines has kind of a universal healthcare system there. It's called PhilHealth. And we have this one report that shows in the Western Visayas region, there's been 81 million pesos worth of benefits paid out for over 8,000 dengue cases in the Western Visayas in the first 6 months or so. And they say this is about 223% higher than the same payment on claims for dengue last year at the same time during the same period, right? So data from PhilHealth reveal that Negros Occidental has the most number of dengue confinements at 40%, with about 3,300 cases. And this is followed closely by Iloilo and Aklan. It says PhilHealth provides benefits for dengue based on the severity of the condition, according to the person that heads the department. Quote, patients diagnosed of dengue fever are given a package of 10,000 pesos, while 16,000 pesos is paid for patients with severe dengue condition. I'm going to go ahead and go around the archipelago a little bit with a few places where they're either experiencing a massive surge of dengue, which is a lot of the places. A lot of them have declared a state of calamity, kind of a state of emergency for that area. And in Zamboanga, Sibugay, they are seeing quite increase. As a matter of fact, the Provincial Health Office in that province has recorded over 3,000 cases and 12 fatalities. The figure is higher by 1,466% from the 150 cases reported during the same period last year. Well, this has really got the public, the citizens of the residents of Zamboanga, Sibugay, to really start taking action. And there's a report that shows that about 200,000 residents joined a province-wide simultaneous cleanup drive on Friday, trying to get rid of mosquito breeding sites in the province. Governor Wilter Yap Palma initiated the cleanup drive to destroy the breeding areas of dengue-carrying mosquitoes after the government passed a resolution Tuesday declaring the province was under a state of calamity. And also down in Mindanao area, in the province of South Cotabato, that province has been placed under a state of calamity due to the large amount of dengue cases and the way it's rising. South Cotabato Governor Reynaldo Tamayo signed an executive order on Wednesday regarding the move after 3 cities already declared a state of calamity since last week. So let's see if we got some numbers here. Yeah, here we go. A report released by the South Cotabato Integrated Provincial Health Office showed that dengue cases in the province reached a total of 3,347 from the beginning of the year through July 13th, and are above the epidemic threshold. And this is 149% higher compared to the 1,300 odd cases recorded during the same period last year. And 17 deaths have been recorded in South Cotabato. In the province of Leyte, in the eastern Visayas, they've also declared a state of calamity because of dengue. And it says that the Leyte's provincial board has placed the province under a state of calamity as dengue fever has killed 6 children and hospitalized 1,747 since January. And this number does not include 2 major cities in the province, Tacloban City and Ormoc City. They're not included because they are independent from the province. So, the top 5 areas with recorded cases are the towns of Santa Fe, Baybay City, Jaro, Palo, and Alangalang, all reporting well over 100 cases each. So we don't even know what the case counts are, according to this report, of what's going on in Tacloban and Ormoc. And in central Luzon, in Cavite, they've also declared a state of calamity. Governor Juanito Victor Remula declared a province-wide dengue outbreak and state of calamity due to the increase in cases and fatalities. And he made that announcement on Thursday. Now, according to the Cavite Provincial Epidemiology Surveillance Unit, from January 1st to July 13th, there were 18 fatalities and over 3,600 cases already recorded in the province. So, yeah, so the point is, I've showed you provinces from as deep south as Mindanao, here in central Luzon, and right there in the middle with Leyte in the Visayas. There's no place that has basically been immune to dengue fever in the Philippines. So, and let me go ahead and close it out with this. The president just signed this past week a bill which made a law. It's called the Implement Republic Act 11332 to prevent epidemics. Now, the Department of Health urged all private and public health workers, especially at the municipal, provincial, and barangay or the village level, to report all public health threats and emergencies to the DOH to continuously promote the welfare of the people as mandated under the newly signed law, which is also known as Mandatory Reporting of Notifiable Diseases and Health Events of Public Health Concern Act. The new law aims to protect people from public health threats through the efficient and effective disease surveillance of diseases of public health concern, like dengue. The new law recognizes the disease surveillance and response systems of the DOH and its local counterparts as the first line of defense against epidemics or any events that may pose a health threat to the public. According to Secretary Duque, quote, "With the new law, we will be able to ensure timely and accurate health information on notifiable diseases and other public health related events to citizens and health providers. This law will greatly help inform preventive measures and epidemics response in the country." Close quote. So the Philippines, like much of Southeast Asia, are getting hit very, very hard. And they're not alone, right? Vietnam is. We see cases increasing in places like Bangladesh and other countries in that region of the world. We see it going on in heavily in South America. Brazil is just well over 1 million cases. So there's a lot of dengue going on this year, and it's very heavy. So we'll be keeping a very, very close eye on the Philippines and these other countries as the year moves on. Okay, that'll be a wrap. I appreciate you listening, appreciate you watching. And go ahead and like it, share it with your friends, and I'll see you next time on the next Infectious Disease News Brief.